Over 60? Take one vitamin daily to reverse nerve damage in 2 weeks. If your hands and feet feel like they are being stabbed with 1,000 tiny needles, I need you to stop what you are doing and listen carefully. What I am about to share helped one of my patients regain feeling in her fingers in just 14 days using something widely available and surprisingly affordable. But here is what is truly concerning. If you ignore this tingling and numbness, you are not just dealing with discomfort. You are risking permanent nerve damage that can lead to devastating falls, complete loss of sensation in your extremities, and a dramatic decline in your independence. The good news is that catching this now means you can reverse it. Over the years, I have dedicated myself to helping people over 60 reclaim their health and vitality. Today, I'm going to reveal exactly which vitamin your nerves are desperately crying out for, why it works so powerfully, how much you need to take, and the critical mistakes most seniors make that prevent them from getting results. Understanding the urgent signals from your nerves. I want you to ask yourself if you are experiencing any of these warning signs. Do your hands or feet tingle when you are trying to sleep at night? Do you have trouble feeling hot or cold water when you turn on the tap? Are buttons becoming harder to fasten even though your hands look perfectly fine? Do you feel unsteady when walking, like you're not quite sure where your feet are landing? Or maybe you have noticed a burning sensation in your feet that just won't go away. If you said yes to even one of these symptoms, your nerves are sending you an urgent distress signal. Your nerves are like electrical wires running throughout your entire body, sending messages from your brain to your fingers and toes. These nerves are covered in a protective coating, almost like the plastic insulation on an electrical cord. As we age, especially after 60, the body's ability to maintain this protective coating decreases. When that coating breaks down, your nerves become damaged, exposed, and start misfiring wildly. That is exactly what causes the tingling, the numbness, and that terrible burning pain. The essential fuel for nerve repair. There is one specific vitamin that your body absolutely needs to repair and maintain that protective nerve coating. Without it, your nerves simply cannot heal no matter what else you do. With it, you can actually reverse the damage that has already occurred. I am talking about vitamin B1, also called thiamine. This is not just another supplement trend. It is an essential nutrient for your nervous system. In clinical practice, I have seen remarkable transformations. I have watched people who could not hold a coffee cup without dropping it regain full hand strength and coordination. I have seen patients who could not feel their feet when walking become steady and confident again. These are not rare exceptions. Your body is incredibly resilient and wants to heal itself. Your nerves are designed to repair themselves when given the right support. Think about it like a car. If you never put oil in the engine, the parts would eventually grind together and stop working. Vitamin B1 is like oil for your nervous system. It keeps everything running smoothly, protects those delicate nerve fibers, and helps messages travel from your brain to every part of your body without interference. When you don't have enough B1, it is like running your nervous system on empty. The messages get garbled, and the signals misfire randomly, leading to that pins and needles sensation. Why seniors are silently deficient in B1. Many adults over 60 are deficient in B1, and most don't even know it until the nerve damage becomes severe. Studies show that up to 1/3 of older adults don't get enough B1 from their diet alone, and the numbers get dramatically worse if you are taking certain common medications. There are 3 main reasons for this. First, as we age, the stomach produces less acid, which means we cannot absorb B1 from food as efficiently as we did when we were younger. A healthy 30-year-old might absorb 60 or 70% of the B1 from their food, but after 60, that can drop to 20 or 30%. Same food, same portion size, but your body just can't extract and use it anymore. Second, many common medications actively block B1 absorption or deplete your body's reserves. If you are taking medications for diabetes, particularly metformin or water pills for blood pressure, those can drain your B1 levels dramatically over time. Some heartburn medications do the same thing silently. These medications help one problem, but create another one that nobody warns you about. Third, modern food processing strips B1 out of most foods. White bread, white rice, and processed foods are essentially empty of this vital nutrient. The turning point for nerve health. Consider the story of a 71-year-old patient named Robert. He was very health conscious, walked every day, and ate plenty of vegetables. Yet, he complained about numbness in his feet that felt like walking on thick socks constantly. He was terrified he might have serious circulation problems. When we ran comprehensive blood work, his B1 levels were dangerously low. It turned out that a diabetes pill and a water pill he had been on for years had been quietly draining his B1 reserves. We started him on B1 supplementation, and within 3 weeks, he could feel his feet again. He felt stable and confident for the first time in months. He told me it was like someone turned the lights back on in his body. This is a clear illustration of how many people are suffering needlessly. If you are over 60 and experiencing any kind of tingling or weakness, every day that passes with low B1 allows more damage to occur. Early damage can be reversed quickly within weeks, but long-term damage takes much longer and sometimes cannot be fully reversed. Time matters here more than you realize. Furthermore, low B1 doesn't just affect your nerves, it affects your energy levels, your mood, your memory, and your balance. The correct protocol for reversing damage. Now let me tell you exactly what you need to do to get results. Step 1 is getting the right form of B1. Not all B1 supplements are created equal. You need to look for one specific form called benfotiamine. Regular thiamine gets broken down quickly in your stomach before it can help your nerves effectively. Benfotiamine, however, stays in your body much longer and works significantly better for nerve repair. It is specially designed to reach your nerves where they need it most. When you are looking for a supplement, read the label carefully and look for that specific word, benfotiamine. Step 2 is getting the right dosage. For nerve repair, I recommend between 150 and 300 milligrams of benfotiamine daily. This is the therapeutic dose for healing damaged nerves effectively. Because B1 is water-soluble, your body only keeps what it needs and safely eliminates the rest. You cannot take too much, and there has never been a documented case of B1 overdose. If your symptoms are intense, start with the full 300 milligrams. Step 3 is consistency. Take your B1 in the morning with breakfast. It provides energy, so taking it at night might interfere with your sleep. Taking it with a meal that contains healthy fats like eggs or avocado helps your body absorb it better. Consistency is everything. You need to take it every single day without fail to keep the repair process moving forward. What to expect during the healing process. When you start taking B1 properly, you can expect a series of changes. During the first week, you might notice increased energy and mental clarity before any nerve changes become apparent. Many patients feel less foggy mentally within just a few days. The second week is when the first hints of nerve improvement usually start. You might find that your hands don't tingle quite as much when you wake up, or your feet feel slightly more normal when walking. These small changes are signs your nerves are waking up. By the third and fourth weeks, the improvements become more obvious. The constant tingling starts to quiet down, you can feel textures better, and your balance becomes steadier. By the second and third months, the improvement is often life-changing. I had another patient, Margaret, who could not feel her grandchildren's hands when they held hers. She was dropping things constantly and was terrified of losing her independence. Within just 14 days of starting benfotiamine, she could feel a real difference. Within 6 weeks, she was buttoning her own shirts again without help. Within 3 months, she was back to knitting and sewing. Her body healed itself once it finally had the right fuel. Safety and team-based nutrition. Before you begin, there are a few critical warnings to keep in mind. First, get proper testing if possible. Ask for blood work that includes B1 levels so you can track your progress objectively. Second, if you have kidney problems or take multiple medications, consult your provider first to be responsible. Third, be aware of medication interactions. If you are on diuretics or diabetes medication, your levels need to be monitored more closely. It is also helpful to know that B1 works best when combined with other B vitamins, specifically B6 and B12. These vitamins work together as a team to support nerve health. Instead of taking B1 in isolation, you might consider a high-quality B complex that specifically uses benfotiamine as the B1 source and includes at least 100 milligrams of B6 and 1,000 micrograms of B12. This combination is particularly powerful for those looking to see the best results in the shortest time. Your daily action plan for recovery. You do not have to live with nerve damage or accept tingling as an inevitable part of aging. Your body has an incredible ability to heal when given the right tools. Here is your simple action plan. Starting today, take 150 to 300 milligrams of benfotiamine with your breakfast. In the second week, ensure you are also getting adequate B6 and B12. Keep a simple symptom journal to rate your tingling and numbness on a scale of 1 to 10 each day. This helps you see the progress even on days when it feels slow. Always take your vitamins with food. Avoid excessive alcohol, which depletes B1, and stay hydrated with 6 to 8 glasses of water daily. This protocol has helped countless people reclaim their quality of life. I encourage you to take that first step today. Your health is in your hands, and your best years do not have to be behind you. Reclaim your comfort, your confidence, and your independence by giving your nerves the fuel they have been crying out for.